Hi, I'm Dr. Mark King from the Motion Palpation Institute. I want to talk just a couple of minutes about lumbar disc syndrome. I know it's a big topic. We're going to talk about just a couple of the high points. These patients are often in a lot of pain. So we need to help these people as soon as possible because they are very uncomfortable. Obviously, the leg pain is the big problem. So your neuro exam becomes very important. We use a model like this to show what a disc herniation might look like with the plastic model here, and that comes in handy from a patient education standpoint. Your neuro exam has to be thorough, and you have to get good at it. It's an important part of the exam. These patients often have pain that's worse with flexion. So if you have them just bend down to touch their toes, that often doesn't go well. They often cannot sit comfortably. That compression is a problem. Big issue is if they're able to get some sleep, because if they're not sleeping, you lose them as a patient, because if you go back in time, if they want to torture war prisoners, they don't let them sleep. So if your patient's not sleeping, they're heading for trouble. So when you do your exam, do you get any reduction, any centralization, as they say, with end range loading, maybe extension or lateral flexion, whatever it might be? Do you get some centralization of the pain so the leg pain is less? If you do, well, then now you have a homework assignment for the patient. These patients often need medication. So much as we're holistic, some of these patients temporarily need medication, and their family doc or orthopedist or neurologist, whatever, can prescribe something for that. X-rays, they'll tell you if there's some DJD. They're not going to tell you, obviously, about soft tissue. The MRI would show more of that. From a treatment standpoint, you got to get them sleeping, like I keep saying. So if they have to take medication so they can sleep short term, okay. Like I said, they're going to go crazy, so to speak, if they don't. You're going to do your adjustments. Very safe to do your adjustments on these patients. But when you put them in a position to adjust them, if that increases their leg pain, back up. That's not the patient you need to adjust. They're not ready for that then. If they respond to end range loading, that's a take home. You're going to start your rehab slowly, but as soon as you can start it, get going with it. Some of these lumbar disc patients respond well to traction. So that's another tool that you can use. They can ice at home, obviously. If they anti-inflammatory supplements, they're not as powerful that day one as a medication, but if you can get them going on anti-inflammatory supplements, that's a good short and long-term help for this. Sometimes these people have to try an epidural. One of the recent findings showed that when they do an epidural, if they end up with a surgery within the next 6 months, they're twice as likely to end up with an infection. So do the epidural because you're trying to avoid surgery. That's sometimes has to be done, much as we may not like it. And then a certain percentage of your patients, you're going to have to direct them to a good surgeon because they're not responding to your care. So you have to do what's in their best interest, even though you may not like it. Sometimes they require a surgery. Just a few things I want to hit on with lumbar disc syndrome. I hope that helps. Thank you.